we're working in a landscape that is saturated as well. Everybody has a podcast, great. Everyone now has a voice. Everyone has a television studio in their hand or in their pocket. And it's flooded. So you're right, it's how do we get through the noise and how do we make people care? How do we take that data? That's our job as journalists. How do we take these important statistics and I guess make them sexy or make them engaging so people watch or read for more than 3 seconds?
When you look at the actual reads and the hits these stories get compared to, other aspects of health, it's really, really minimal. It's an ongoing, that's a kind of key challenge for everyone in this field. I mean, I feel for me, when I look at some of it, obviously, there's incredibly important conversations about access to land capital. And it's sort of, as a storyteller, it's like, how do you sort of bring that out in a way which will make it palatable to people, and actually get people to click on it and care?
Beatriz yesterday mentioned that people think the battle has been won. They think you don't die of AIDS, so why bother? There's a treatment. So that's why you need very important news to attract attention. There's a misunderstanding.
I try to do the big picture stories, connecting the dots so that people still have a sense of what's happening even if they're not following it step by step. But the other thing I struggle with is the lack of data, as Beatriz was talking about. So, we had this UNAIDS report that just came out, and it's good to document, but I'm looking at the number of new infections, and it really hasn't changed all that much, and partly it's early days, but also partly what are we measuring? The data systems are all down, so I'm not sure if I can take that news to my readers and say this is the information when I myself am not sure what exactly we're looking at. So if I can't be sure that the information that's being delivered is accurate, or not that it's inaccurate, but maybe based on incomplete information, maybe that's not something to cover. And you wait for better data, you wait for a better story, you wait for a day when things are a little bit clearer.
The challenge for me as a journalist is how to translate integrated care from a conference topic into a feature article, which is not just going to come out suddenly by my editors sort of yawn at the pitch. So I think, as Apoorva said, a lot of it comes down to either data or you've got to inject a sense of drama. Why are we reading this now? So integrated care as a topic is too general, too broad, really, for a feature for people to care about. But if you can pin it to a place, like find a country where the burden of infectious diseases and NCDs is particularly acute, how they're tackling that now. And so that's a challenge for me as a journalist to find what that place would be to make that story bring to life. Right? As Beatriz kind of mentioned, as a lot of people have said, the idea of trying to bring HIV into sort of mainstream healthcare is bullshit. And there's going to be lots of huge, conversations about that going forwards. But again, need to centre it on a place, find lots of, right kind of drama, the statistics, the data to really be able to tell that story. So to sort of get that over the line in a package which my editors would find interesting is an ongoing challenge.
Domestic health policy is what receives most of our attention. It is in such bad shape right now that those of us who cover these policies end up staying almost entirely focused on domestic news. And there's simply too much happening, and there isn't a lot of time or energy to cover anything more. So I describe it less like global versus domestic, as you just don't have time to be bothering about what happens anywhere in the world. You have to concentrate on what is happening at home. Every hour, every day, you have a worse news to cover.
As journalists, we know that we have stories that we have the in-depth feature stories that are done, and of course we have the STCs and the overlays and all that. So I realized that most of the stories about the America, like the the MOUs were actually straight cuts, where the news anchor just reads the script, then the speaker talks. Like there's no in-depth reporting of these. So I feel like there needs to be, can I say, a training of more health journalists.